Good evening and welcome to the Tuesday, August 24th, 2021 Health Ed meeting. Chairman Allen is under the weather this evening. She was tested. Fortunately, it was negative, and we expect her to be back in the pink very quickly. We'll begin this evening by calling roll, Ms. Rachel.
Commissioner Cook?
Yes.
Commissioner Key?
Here.
Commissioner David Gammon?
Here.
Commissioner Gurley?
Here.
Commissioner Phillips?
Present.
Vice Chairman Blair?
Here.
We have a quorum.
Thank you, ma'am. Next order of business will be to call on Chairman Pro Tem Jeff Phillips for approval of the minutes.
Thank you, Mr. Chairman. I've reviewed those minutes. I find them to be in order and move that we dispense with the reading and that they be adopted as presented.
Thank you, Mr. Chairman. Do we have a second?
Second.
Thank you, Commissioner Gurley. Any questions, comments? All in favor, signify by saying aye.
Aye.
Any opposed? Motion carries. Thank you, Mr. Chairman. Next will be our Health Department report, and we have Director Dixon and Dr. McDonald with us. So a lot going on these days, so happy to have you.
Yes, thank you. Vice Chairman Blair and Commissioners of the committee, good evening. Can you hear me?
I said you can put your mask down where we can hear you.
Okay. Well, we've been asked to wear our masks throughout the in-person. Yes, I'm sorry. So tonight we'll be presenting the Health Department report of community health outreach and also providing COVID-19 updates, as we have a lot to update you all on this evening. So please take a look at our July 2021 report of community health outreach. Our numbers are slowly but surely starting to increase in our protect column, our promote column, and our improve. I do want to draw you all's attention to some of our events that we've been able to go out and do in the community, as we have been asked to actually step back from doing a lot of that due to our increase in COVID-19 cases. But we were able to host a drive-through hygiene drive in partnership with a community agency, as well as still planning for our Recovery Fest with our substance misuse, and then also additional COVID-19 related activities, such as going out doing testing events and also vaccination events. And so I did want to draw you all's attention to that. Additionally, we do, as some people have forgot, still offer traditional health department services in the midst of doing our vaccinations and testing. And so you can see our clinical encounter numbers are starting to increase, especially our WIC program, which is our Women, Infant, and Children program. And I think a lot of that is due to COVID-19 and our families needing more assistance with financial assistance, but then also food assistance. And so that is a program where we're still seeing quite an increase in our numbers. So moving on to our COVID-19 updates, as we have a lot to present to you all this evening, and Dr. McDonald is going to step in and give you all a little bit more insight from the medical perspective. But currently, our COVID-19 testing and vaccinations are taking place at our Murfreesboro Health Department, located at 100 West Burden Street. Our vaccinations, yesterday the Food and Drug Administration did issue a full authorization for our Pfizer COVID-19 vaccine for individuals ages 16 years of age and older. So very excited to hear that news come out. I do want to also make mention, though, that the vaccine remains under the emergency use authorization for those individuals who are 12 to 15, and also for the administration of the third dose option for individuals who are moderately or severely immunocompromised. The full license approval from the FDA is given after more than 9 months of data review and continued case study. So it went through 9 months of approval. The Pfizer vaccine has also been available in Tennessee since December of 2020, with approximately 3.4 million Pfizer doses being administered to date. I also want to take this time to reiterate and recognize that while we all can agree that vaccines is a personal choice, the COVID-19 vaccines are our best defense at preventing the continued spread of this virus. As public health officials, and I hope as our Health and Education Committee, we will continue to strongly encourage everyone to be vaccinated, and will continue to provide vaccinations here in our county to anyone who would like to receive one. More good news about our vaccinations. Our vaccination rates across the state and here in our county have increased over the last month. as we unfortunately experienced surges in COVID-19 cases due to the highly contagious Delta variant. In particular, younger Tennesseans are choosing to receive the vaccine with the highest rate of increase in the 12 to 15-year age group and the 16 to 20-year age group. Individuals who are seeking more information about the COVID-19 vaccinations can visit covid19.tn.gov or vaccines.gov to schedule an appointment with their local healthcare provider. Furthermore, we are continuing to administer vaccines Monday through Friday from 8:30 to 12, and then from 1:30 to 3:30 at our health department here in Murfreesboro. Once again, it's free. No appointments is necessary for vaccinations, and we are offering the Pfizer vaccine. Today, we saw 291 individuals with given out, and then additional 77 that we gave out self-tests to. So there's almost 400 individuals that we saw just this morning from 8:30 to 12. We are vaccinating roughly 40 individuals daily, so this increase from the last time I was in front of you all, which I think we had about 5 individuals that we were vaccinating at that time. Now we're up to 40 individuals, but this is also inclusive of first dose, second dose, and also third doses. Booster shots are not being given at this time, and we are estimating mid to late September for those booster shots to start to be administered. The single number of vaccines reported in our county is 271,364. Of all eligible residents ages 12 years of age and older, Rutherford County has vaccinated about 44% in total. So moving on to testing. So this week, we are doing drive-up testing at our health department, once again, Monday through Friday, 8:30 to 12. And then starting next Monday, with the gracious support of Mayor Ketron, getting us back over to State Farm, we'll be moving testing only to State Farm. Like I said, with the 400 individuals that we saw today, we were blocking almost every street in downtown Murfreesboro. So we're going to move back to State Farm so that we can be able to service our community a little bit better. And so that drive-through testing will take place Monday through Friday from 8:30 to 12 at State Farm, which is located at 2500 Memorial Boulevard. Additionally, we are still giving out self-test kits, which can be picked up Monday through Friday from 8:30 to 4 at both of our health departments. And then we will also start giving those out at State Farm starting next Monday to anyone who is ages 16 years of age and older. So this is a change that has happened. I think originally it was 18, and now we're able to give those to anyone who's ages 16 years of older. Along with testing, we will continue to work all public health investigation that goes along with positive cases and their contacts 7 days a week. According to the Tennessee Department of Health dashboard, Rutherford County over the last 7 days averaged a positivity rate of about 17.5. Back in June, we were at 1%. We are now at 17.5. And so I do want to share a little bit more data with you, and I know I give you all a lot of numbers every month that I'm in front of you, but I think these are some numbers that are very important as we look forward to what we're going to do moving forward, especially with our children. So starting with children's data, ages 0 to 10, unfortunately, this is the worst that has ever been here in Rutherford County. 97 cases were reported on Friday, which is 3 times more than the last record of 32 cases per day. Currently, the 7-day average is 44 new cases per day in this age bracket, and is climbing sharply. And this data is of as this past Saturday. For the general population, the data as of Monday, the 7-day transmission rate is 256 new cases per day. 256 new cases per day, which is 7 times the state acceptable rate. Right now, currently, we are at 2,894 current registered cases in our county, which is almost the high at our winter peak that we had. So New York Times is also showing that our regional hospitals have less than 20% ICU vacancy, which is more constrained than Tennessee, which is 26%, and the U.S. at 32%. And then the CDC is also estimating that 93% of all cases in Tennessee is the Delta variant. So it's safe to assume that all individuals who are currently testing positive are testing positive with the Delta variant. The vaccines, once again, seems to be almost completely effective for preventing serious illnesses or death, but also much less effective from actually getting the virus and carrying it. So furthermore, since COVID-19 update meeting that we had last week with the mayor, I'm pleased to say that we have met with our amazing city and county public information officers to help with consistent, clear messaging and information to be shared via social media, city and county TV, and with our community partners. We truly want to give people a dose of hope here in our county. Also, in an ongoing effort to maximize our outreach and access for testing and vaccinations, the Rutherford County Health Department will also continue to support the work of our school systems, universities, churches, workplaces, and other community groups as we continue to provide education and guidance. Once again, I do want to take this time to say thank you to our staff at the Rutherford County Health Department and all essential employees in our county, as well as Chris Clark, law enforcement. And then with law enforcement, I do want to give a special shout out to Officer Woods, who has provided us with assistance over the past year, and anytime we needed him, he was always there for our health department, even when we had to call him this morning to get out of that traffic jam that we were having. So as we continue to monitor trends across the state, we will continue to look at and identify problem areas and improve early indication as we look at the increases that are going to happen with community transmission. Finally, I want to take this time to remind us all, especially as a Health and Education Committee and those who are watching, of the 3 W's. Wearing a mask, watching your distance, and washing your hands, as well as the 3 C's, avoiding crowds, close contacts, and confined spaces. At this time, I'm going to turn it over to Dr. Mack for her to give us a few more updates regarding boosters versus vaccines, and also to talk a little bit more about if you're thinking about getting vaccines and you're kind of hesitant. She's going to give you a little bit more updates on kind of what that looks like, and then I know there's been a lot of questions about symptoms that you may experience after receiving a vaccine as well.
I think the important thing is the variant has changed the game a bit for us. The initial infections that we had were 7 to 10 days. Now we're looking at about 3 to 5. I see that these folks are, this is the Delta variant, over 90%, as LaShannon just said. We don't test for it. People ask me that all the time, do you test for which variant? We presume it's that variant. And it is covered by the vaccines, so it's almost a moot point. The bottom line is, really what we have to do is get the majority of our people vaccinated. If you look at side effects from the vaccine, it's really minimal. And if you look at how infective, and I have some close friends who, one person in the family was vaccinated and the other wasn't, and now the other is not doing very well at all. And that hurts me because that did not have to happen. So once again, I can't say any more strongly that this is the thing that will save most of us, and we should really strongly consider doing it. Vaccine hesitancy is difficult. I've talked to lots of people about the reasons. I go back to the same story. You're not just doing it for you, you're doing it for your friends, your family, the older folks you deal with, people that are not well, people that are going to have surgical procedures in the near future. We need bed availability in our hospitals to carry on with all the other illnesses that we have out there. I mean, patients cannot get into the hospital because they're too full, the parking lots are full, you're sitting in cars, sometimes waiting. So there's a lot of reasons to do it, and I just can't, I feel very strongly about it, and I think it's an easy thing to do, and we should do it. We don't know if there's going to be another variant come along. Like I think I said at one of the last meetings, these viruses live to mutate and get into our bodies. Fortunately, our vaccines are very effective against all of the variants that we've seen so far, both Pfizer, Moderna, and J&J. So if you have any of those vaccines on board, you're in good shape. I'm happy to answer questions, but the bottom line is we're seeing a lot more infections in kids. They're difficult to rein in because kids are kids. I mean, they're not used to mask wearing, they're not used to distancing, and when they start playing, they forget. And they sometimes bring that home to their parents who are not so lucky. So that's my big message for the day is we can stop it, we can get back to normal, but we got to do it, or we're going to be...
McGurley.
Yes, Dr. McDonald.
Yes.
I received an update on Vanderbilt this afternoon. They are creeping very high right now in terms of both number of cases and number of percent of cases. 60% of the number of the caseload that they have now are in ICU. How are we doing at STR and Stonecrest?
Pretty much similarly. Of the people, the last numbers that I have of the people that at St. Thomas Rutherford, the majority of the people are COVID positive in the ICU. Of all of them, all but one was not vaccinated. And typically, and we know the vaccine isn't perfect, if people are on certain treatments for their Crohn's disease or ulcerative colitis, the vaccine doesn't work as well, which segues nicely into the whole point of the third dose. We're hoping, and we see this in some of our other immune-compromised people, like our HIV population. It takes more than 3 hepatitis B vaccines for that group to get immune, because they have an immune thing going on in their body. So that third dose is being offered for those immune-compromised people, and highly recommend it. And the boosters for us, as LaShanne said, later in the month, depending on when you had your second shot.
Chairman?
Thank you. Dr. McDonald, let me see if I heard this correct. Boosters, if you had your first shot in February, when would you be eligible for a booster? September?
November, probably. Yeah, and I don't think there's a big hurry for that. It's probably somewhat arbitrary that they chose like the whatever month they chose. But if you have any underlying, if you're diabetic or if you have heart disease, I would probably, if that were me, I would line up probably earlier.
And for those that are listening, those elderly who have a lot of underlying health conditions, they've already been vaccinated early this year, they're eligible right now for the booster?
If they were in January, when the booster won't be out, I don't think until mid or late September, yeah, they could come on down.
And what's the best way to do that? Do you need an appointment, or do you just come to the health department? Okay.
At this point, yes, and if our numbers pick up, we'll have to kind of go with the flow and figure out the best way to provide the services we need to. We're pretty good at that.
And, Mr. Chairman, if I could elaborate just a minute, what I heard both of you guys say is that a lot of folks are not getting the vaccine because they're concerned about what's going into them, and it might make them sick. What I just heard you say is that the side effects are minimal, if any, and the percentage of side effects, of having any side effects, are very, very low.
Very low. I mean, the biggest side effect in all the studies, and there's been tons done across the world, are sore arm. That's about 80-something%. And we all get sore arms. I mean, I get it with my flu shot every year.
And also, to repeat what you said, the vaccine is not only important for you, but for those that you come in contact with, especially if you get outside any and deal with the public. It's important that you get the vaccine to protect other folks.
Absolutely. I mean, there is some people that, in many of our other vaccines that just can't take a vaccine because of their immune system. They depend on all the other kids around them or all the other adults around them to be protected so that there's no disease in the community so that they don't get it. So I think the vaccine hesitancy group, if we can talk about that more often than the things that could go wrong if you got a vaccine, just help somebody else out. Could be your mom, it could be your grandmom, doesn't matter.
One more follow-up, flu shots. A lot of us get our flu shots in October, the first part of October. And if we're not eligible for the booster until November or December, go ahead and get your flu shot in October.
Sure. I mean, it's interesting because we always go with Australia, as they've already gone through the winter. As we approach winter, they're going into summer to see what kind of what is causing seasonal flu, and they've seen very little. I think some of that's our masks, and so no one really knows, You know, I heard, I was listening to NPR the other day, and the vaccine person for the influenza was saying, we really don't know what ingredients should go in it, but we're going to make our best guess based on other countries, and they still highly recommend that vaccine as well.
Is the turnaround time for the results of the test, are they the same as they were back months ago? Or and we don't do the rapid test. We actually have to go through, and it takes a few days to get the results back.
Yes, so currently our turnaround time is 2 to 3 days. However, that will vary as we are seeing an increase. And like I said, last week I think we did maybe 100, and now we're doing close to 300-400. So we probably will see a little bit of a lag, but right now the turnaround time is 2 to 3 days, and we are offering a PCR test at our health department.
Okay. And it's our understanding now that some of the pharmacies, or at least they're charging for the test now, and we continue not to charge.
Yes, we are free, and no appointment is needed as of right now.
Okay. Commissioners, any other questions? And I get a motion to
Mr. Chairman, I move to approve the report.
Thank you, Mr. Chairman.
Second.
And Commissioner Gammon. Any other questions for Director Dixon or Dr. McDonald? If not, all in favor say aye. Aye. Any opposed? Motion carried.
Thank you.
Thank you, ladies. Your plate continues to be full.
Thank you.
Next is on the agenda is the community care report, and the mayor's not here. I think, Ms. Rachel, you have a little information to share with us.
Well, the minutes from the last meeting are on your SharePoint tablets there in front of you. Kind of gives you a snapshot of all the going-ons out at CCRC. As of Friday, the last correspondence that I received, we are still COVID-free, staff and residents, as of this past Friday.
I don't think we need to approve your report, do we?
No.
Okay, next is special projects, and I do see Ms. Jolly. Nice to have you. Good evening.
Okay, I actually have made some changes on this report. I've reduced the budget in Rockville Elementary Annex, Rockville Middle, and Smyrna Middle Annex. So you'll be able to see that on page 4. And part of the funding's going to change, what they're going to have to go borrow, because we transferred the money from the future elementary project to the Rockville Elementary project, so that reduced it $1,783,301, and then we transferred from Rock Springs Elementary $2,335,385, and you can see that on the, I think it's page 7, if you can actually see that. That's it.
Any questions? Since this is some change in money, is this one we actually need to do a roll call vote on? No? Okay.
Move to approve the report, Mr. Chairman.
Thank you, Mr. Chairman. And Commissioner Cook, second. Commissioner Gurley?
Second.
Okay. Any questions? All those in favor, say aye. Aye. Opposed? Motion carries. Thank you, ma'am.
Thank you.
Good to see you. We hadn't seen you in a few months. Okay, next is Mr. Spurlock, Director of Schools, for the school board report. Welcome, sir.
Good afternoon, everyone. It's good to be here. We've got 3 budget amendments here. 2 of them are 177, and one of them's on the 143. It's my understanding we're going to take all 3 together.
Yes, sir, please.
Starting off with the Wilson Elementary amendment there, installation of a turn lane and pickup lane. Due to the increased enrollment with Wilson Elementary, it currently is in need of a dedicated turn lane and pickup lane due to the fact that about 75% of the students there are driven to school and picked up daily by their parents. The installation of this turn lane on the edge of the school property will enhance the safety for our students as well as provide a safe turn lane for vehicles that are currently backing up onto Cutoff Road. The cost for this is this lane for traffic improvement is estimated at $68,000. The second one, capital projects budget amendment, Fund 177. Of course, each July 1st, outstanding purchase orders in the Fund 177 are liquidated. These funds are placed into fund balance 34685, committed for capital projects. These purchase orders are for projects that have not been finished by June the 30th. This amendment takes those funds out of the 34685 and committed for capital projects and rebudgets it for expenditures for the carryover projects that weren't finished as of June 30th. This year, the amount of $2,564,032 in funds to rebudget for these carryover projects.
Before you make your motion, Mr. Director, any questions from the commissioners regarding either one of these motions? Let's take Wilson Elementary first. Is there a motion in regard to that?
I move to approve the motion for Wilson Elementary to allocate $68,000, Fund 177.
Thank you, Commissioner. Is there a second?
Second.
Second, Mr. Key. Thank you, Commissioner Key. Any other questions for the director? Okay. Rachel, if you'll call roll.
I have.
Yes, Commissioner Gammon.
I know we're trying to watch infrastructure and so forth. The turning lane, did we just not, was that something that just came up at last minute?
I think it was left out, and as the school increased in population enrollment, they started pulling off the side of the road, and it created a pretty challenging situation. What makes it so difficult, if you go out there and watch the traffic, 75% of the parents are bringing them to school, and that adds an additional burden, quite frankly. But that's their choice,
That's understand. I know we're watching it now, and when we're going further for future reference.
Absolutely.
Infrastructure for these schools, turning lanes, so forth. Thank you, sir.
Wilson was part of the problem that we identified when we specified that all new schools, the traffic studies would be instituted.
Absolutely.
So Wilson was part of that.
Yes, sir.
This really needs to be done. Matter of fact, it has to be done.
Yeah. But I agree with you, going forward, we've got to be cognizant of that. And I think we have, because I think, like Commissioner said, that was pointed out when that was built, that issue.
I might take this opportunity to let you know that Brown's Chapel is another one that has a very short, about 2-car turn lane, but it's nowhere adequate. Cars back up in the afternoon about 2:30 all the way around the curve, and it's especially dangerous when they back up just to the curve, because then people coming around the curve from Blackman Road don't see them until they're almost on them. So that's something that probably needs to be looked at and addressed with the future budget amendment.
Agreed. I've actually had that, sit there and seen that thing myself. Yeah, you're absolutely correct.
Thank you, Commissioner. Any other questions, comments? Ms. Rachel, take roll.
Commissioner Cook? Yes. Commissioner Key?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Aye.
Chairman Blair?
Yes. Mr. Spurlock, if you want to do your second capital project.
Yes.
Budget amendment?
Yeah, okay. The second one was the budget amendment for the outstanding purchase orders from Fund 177 that was liquidated. These funds are placed into the fund balance account 34685, committed to capital projects. These purchase orders are for projects that had not been finished by June the 30th. This amendment takes those funds out of that line item of 34,685 committed to capital project, and it rebudgets it back into expenditures for carryover projects that were not completed by June 30th. The amount of this amendment is $2,564,032 in funds to rebudget for those that are carrying over for this fiscal year.
Recommendation.
Move to approve, Mr. Chairman.
Thank you, Mr. Chairman.
Second.
Second by Commissioner Gurley. Questions for the director? Vote. Rachel, please.
Commissioner Key?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Aye.
Commissioner Cook?
Yes.
Chairman Blair?
Yes. And your Fund 143, Mr.
Yeah,
Director.
143 Centralized Cafeteria Fund Budget Amendment tab. Currently, our school nutrition department is experiencing some hiring issues. It's no different than a lot of the food services that we're seeing around the Rutherford County area. So in order to attract and retain adequate staffing for the school cafeterias, we're requesting that approval of a one-time hiring retention initiative that would provide all Rutherford County schools full and part-time school nutrition employees a one-time bonus of $500. This payment of the bonus is contingent of the following stipulations that will be met by the school nutrition employee. First of all, the employee must be a current or full-time or part-time Rutherford County Schools nutrition employee or be hired as such no later than September 1st of this current year. Two, the employee cannot have a break in employment with the Rutherford County School Nutrition Department between September 1st of 2021 and December 18th of 2021. Third, the employee remains an active employee status during this time period and will be available for reporting for duty as assigned by the Rutherford County School Nutrition Department unless they have an excused absence. Rutherford County School Nutrition employees satisfying these three requirements will receive a $500 recruitment and retention bonus in late December of 2021, less applicable payroll deductions. Funding for this one-time hiring and retention initiative with an estimated cost of $267,293 is to be fully funded with the federal USDA School Programs Emergency Operational Cost Reimbursement Programs Grant Award. Recommend approve this funding, one-time recruitment and retention school nutrition department bonus as presented to help with providing adequate staffing for the Rutherford County School Nutrition Department, and the funding is from the federal USDA funds.
Or move to approve? Thank you, Mr. Chairman. A second?
This is reoccurring.
One time. It's only one time, yes, ma'am. It won't be.
The grant was one time.
Yes, ma'am. And the $500 of.
Year after or whenever, we'll have to do that.
Actually, we're going, at this point in time, we're just doing it, this is non-recurring. Yes, ma'am.
I second, Vice Chair, with discussion.
Okay. Thank you, Commissioner Key. Commissioner Gurley?
The reason I'm hesitant on this, we went round and around last night in public safety over a bonus for which many of those people work in the school system, also for our public safety. I'm not really against this, but I'm going to be voting no, kind of in protest over the lack of any kind of action on our public safety employees, because I don't disagree with this, but then we're seemingly having a problem with doing the same thing for our public safety people. So I'll be voting no.
Commissioner Key?
Yes, sir. I can feel just the opposite of that. I'm voting for it because I don't think I can vote in protest with a good accord when I say that we have the money available. But I would like for you, Director, to give me a history. Give us a history of how did we get to this point, and why do you think this is a good idea?
Absolutely. First of all, to get back to the funding mechanism of it, this funding here has come from United States Department of Agriculture was funding for this purpose. Quite frankly, I think it's a reflection of jobs available throughout the county. I mean, we've got a situation where I think we've got more jobs than we do have people that want to be employed. And, I think, quite frankly, even with this bonus, we're still struggling. We're still struggling to find people to work in our cafeterias. They do a fantastic job. They're serving kids daily. I think it's representative of our nation, quite frankly.
So I'm not opposed to this. I do have a concern that it does set a precedent, and I don't think it is in lieu of helping others. I think this is the one that's come before us, and we have to vote on this with our conscience in this matter.
Right.
Was it just put out there that perhaps an initiative for new hires would be a good thing to show, showing that would be a good level area to go to? And then what about the current? What do you see as far as the current employees, and how does that mix together?
It is actually for the current employees. We want those to stay. We saw a lot of transitioning out, and we were having difficulty, so we wanted to stop the bleed, kind of, if you will, and hopefully we hope this will do this.
So with two separate funds, to Commissioner Gurley's point, so this would be separate money, and it would be them being shown an additional $500.
Right. Mm-hmm. For those employees that are currently employed.
Even when this it would be kind of a double dipping when they get approval on that one. So,
right.
Okay.
Mm-hmm.
Commissioner Gammon.
Yeah, I'm the same way, Mr. Spurlock. I'm a big supporter of the education. I've always have, and that was the first thing that crossed my mind. I'm not on that committee, but I've really been trying to support and been talking to folks about this bonus, whatever we want to call it, for our first responders. I'm going to have to vote no on it. We started this a while back on the other, and I don't want to jump the gun to another department before we get one other finished.
Right.
My other thing is, you say the $500, and they have to stay with you. They have to stay.
They have to be employed as of September 1 and stay with us through the rest.
Okay, what happens if they don't stay with you?
We don't. If they're not with us come December the 18th of 2021, they don't receive that bonus.
Okay, so it's received at the end.
Right. It's received actually in the end of the first, end of the year in December.
Okay.
Yeah. Mm-hmm.
Mr. Chairman.
Yes, I'm not disagreeing with either Commissioner Gammon or Commissioner Gurley, either one. However, public safety was an undefined amount and an undefined number. We didn't know how much it was going to cost, and we didn't know who all was included in it. And that's the reason that's been delayed. This is a defined number and a defined amount, and fully funded by a grant, the federal government grant. So voting against it because of the public safety issue, as all the discussion last night on public safety, I think everyone was in favor of it. However, at least this commissioner was concerned because it was an undefined amount. We had no idea how much it was going to be. We had no idea how many employees would be covered, because public safety could include a whole number of folks. And that committee asked for a definition, and it's going to be reintroduced next month. So that recommendation and this recommendation are different. I have the numbers, I have the amount, and that's the reason I'm supporting it.
Thank you, Mr. Chairman. The other point I would like to make is that this was approved by a separate elected body as well, and they thought it was prudent and it would be helpful to their program, and that's that's why it's coming to us, is because a separate board has approved it. Commissioner Cook, did you have something? Okay. Anybody else? Comments, questions?
Ready to vote?
Ready to vote?
Commissioner Cook,
Yes.
Commissioner Key,
Yes.
Commissioner David Gammon,
No.
Commissioner Gurley,
No.
Commissioner Phillips,
Yes.
Chairman Blair.
Yes. Motion carries. Thank you, Mr. Spurlock.
Yeah, the last thing I know Commissioner Allen, Chairman Allen, wanted to bring some numbers to you guys, so I think I've given that to you. I don't know if I gave you exactly how much growth we currently have. As of at the end of last year, we're about 1,100 students, basically kind of like it's always been, 1,100 students in growth. Typically, by Labor Day, that kind of sets, we know where we are completely with that in terms of that. All right. Yes, sir.
Yeah, I have a question. Would you say that number one, without saying anything you don't need to say, can you give us a rough synopsis of how COVID is impacting the schools?
Oh, absolutely, absolutely. It's really hit us in the food service, because in the food service, it's kind of hard to social distance there. In fact, we've had probably 4 of our central office employees having to go out and serve food, breakfast, and lunch daily. That's been a huge impact. We are still seeing, like the health department gave you, a lot of positives with our students. We are seeing, I think it follows what's all been indicated, is that it's now we're seeing in elementary kids where we didn't see so much last year. As far as the volume, there's no comparison. This one is highly more contagious, so the volume is a lot greater. But I also have to take a lot of things in perspective. For example, at the beginning of last year, we opened up with 40% of our students that were distance learning. So we had less people in the building, and we had greater opportunities to social distance. So that could be some of that also.
Would you say that the state's shackling you or removing that ability to make that discretionary call is impacting it?
One of the things I will say is, and this is not a secret, we have frequent meetings online with our fellow superintendents, and everyone is saying the same thing. Last year, with the continuous learning plan, we were able, when someone went out, a kid or whatever, we were able to shift them over to an online platform. This year, they are counted an excused absence, and we're doing as best we can to meet their needs during that time.
So, bottom line is,
yes,
as far as serving the kids right now, we're probably worse than we were last year. And
one of the things, it's probably more exciting in the school now, but we're having difficulty. You're right. We're having difficulty serving our kids. We're into our 3rd week, and we're developing a lot of challenges. A lot of systems have already, because of staffing, they've had to close a school or 2. We haven't, knock on wood, but we're really approaching some of those things. Absolutely.
But we need to get it across to our legislative delegation that they kind of need to stay out of school process and stick to things they might know something about, and instead of trying to
I think you need
tell our schools how to take care of and of our kids. So I just wanted to bring that up because I know last year, things seemed to go because you had an alternative.
We did.
And this year, for some reason or another, certain members of our legislature have decided that we don't want to have that opportunity, or we don't want to have that alternative this year. So we're going to force everybody to do it this way, and not necessarily the best way. And there may be some school systems that are perfectly okay in doing that way, but then in bigger areas and so on where you have a denser population and so on, that may not be the best. So really and truly, this is not a knock on anything Rutherford County School Board or schools administration is doing, but more of a knock on our legislature.
Mr. Spurlock, I had to do a double take when I was looking at your list and the school populations and seeing that our newest high school has the highest student population in the
Absolutely.
county.
Now, we do have a plan to do a little rezoning there.
Okay.
It will come up in the fall. I always tell people that when the school board and with the commission funding it, built Blackman High School, it was out in the middle of nowhere. They rezoned Cason Lane to Blackman. The next thing you know, it got overpopulated in 2 years. They moved Cason Lane back. It's been going back and forth. It was rezoned 4 times. So we won't try not to do that. Quite frankly, Rockville's growing, but we do have a couple of plans in order to address some overcrowding at Rockville High School.
Would you, Commissioner Gammon, go ahead.
Yes, Mr. Spurlock, I know last year you had some issues with, not issues, but some concerns about crossing guards. How are you doing right now?
I hear less complaints, to be honest with you. Yeah, I do. I hear less complaints about it. The beginning of the school year is always difficult, and it's difficult for everyone. But typically after the first couple of weeks, people understand if you're going to take your kid to school, you might want to get up a little bit earlier and drop them off. And so, kudos to them, because I don't know what we would do without them.
Are you having issues on hiring crossing guards like you did last year?
You did last year, right? We did, but I will tell you, our SROs, it's difficult for our sheriff to find deputies as it is, and we're having difficulties in that area. Yeah, absolutely.
Yeah, I've communicated with you the issue we had here a week or so ago when school first opened at my school complex behind my house, and but it is smoothed out. They've made some adjustments, and it's smoothed out. Like you said, it takes a little bit getting things back running in a rhythm, and things are moving along relatively well. Teachers, and I just added it up, teachers and pupils both into that complex is somewhere near 5,000. And that's a lot of people to put in and out of an area in a short period of time. But it is doing well now compared to what it was a week ago. So there's a learning curve, and but you've made adjustments, and it's flowing very well right now.
Well, we'll knock on wood, and it's all credit goes to those administrators and teachers at those schools.
Mr. Spurlock, would you kind of talk about the virtual school again? I know you've shared some info with us in the past.
Yes, we are actually approved to go grades 3 through 12 in our virtual school. We currently, you can see our numbers there. It's kind of surprising. However, I do believe that that will grow. Of course, it did grow from this previous year. It's not everyone can do the virtual school for several different reasons, especially if they're in elementary school. A lot of parents don't have someone staying home with a child so that they can get on the computer and stuff like that. But it's growing. We feel like it's been very effective. We'd like to see it grow a little bit more, because this provides us, opens up more space in our classrooms and throughout the district.
Thank you, Mr. Spurlock. Anything else for the director?
Just to follow up on your point about Rockville, is the core number the same in Rockville as there are other high schools?
It is. It is.
Thank you, Mr. Spurlock.
All right, thank you.
Okay, that concludes what we have on our agenda. Anything else from this committee this evening? We'll wish Chairman Allen a quick recovery from her, hopefully just a summer cold, and appreciate the patience of you commissioners. Without anything else, we stand adjourned.